Depression is more than just feeling sad or down. It impacts thoughts, feelings, and behaviors, making daily tasks difficult. It can disrupt sleep, leaving individuals feeling exhausted even after a full night's rest. It can dampen appetite, leading to significant weight loss or conversely trigger overeating as a coping mechanism. The fatigue, low energy levels, and lack of motivation associated with depression can make it challenging to perform even the simplest of daily tasks, such as showering, getting dressed, or preparing meals. Beyond the physical symptoms, depression takes a toll on cognitive function as well. Concentration becomes a struggle, making it difficult to focus on work, studies, or even conversations. Memory can falter, making it challenging to recall information or events. Decision-making becomes overwhelming, leaving individuals feeling paralyzed by indecision. The emotional burden of depression is perhaps the most debilitating aspect of the condition. Feelings of sadness, emptiness, and hopelessness permeate every waking moment. Loss of interest in previously enjoyed activities known as anhedonia can lead to social withdrawal and isolation. Irritability, anger, and frustration can surface easily, straining relationships with loved ones. In severe cases, depression can lead to thoughts of death or suicide. The impact of depression extends beyond the individual, affecting families, friends, and colleagues. Relationships can become strained as communication breaks down, and the emotional distance widens. In the workplace, depression can result in decreased productivity, absenteeism, and difficulty meeting deadlines, impacting both the individual and the organization as a whole. Major Depressive Disorder, MDD, also known as clinical depression, is characterized by persistent sadness, anhedonia, and a range of physical and emotional symptoms, such as changes in appetite, sleep, and concentration that last for at least 2 weeks. Persistent depressive disorder, or dysthymia, is a chronic form of depression with symptoms lasting for at least 2 years. Symptoms include low energy, poor concentration, and feelings of hopelessness. Premenstrual dysphoric disorder, PMDD, is a severe form of premenstrual syndrome, PMS, that causes emotional and physical symptoms. Symptoms include mood swings, irritability, depression, and difficulty functioning in daily life. PMDD symptoms occur during the week before menstruation and subside after the period starts. Substance or medication-induced depressive disorder is directly caused by the use of substances, for example drugs, alcohol, or medications. Symptoms typically appear during intoxication or withdrawal, and can mimic other forms of depression. Depressive disorder, associated with another medical condition, highlights the link between physical and mental health. It can be a result of another medical condition, such as thyroid disorders, chronic pain, or neurological conditions. Treating the underlying medical condition can help alleviate depressive symptoms. Childhood and adolescence can be surprisingly challenging times for many young individuals. Persistent changes in behavior, mood, and academic performance can signal something serious. Depression in older adults is often overlooked and mistaken for normal aging or other health conditions. Seniors face challenges like chronic health problems, loss of independence, and social isolation, increasing their vulnerability to depression. Symptoms may include fatigue, pain, sleep disturbances, and changes in appetite rather than sadness or hopelessness. Social withdrawal, memory problems, and difficulty concentrating can also be signs. Postpartum depression, PPD, occurs in some women after childbirth and includes symptoms such as severe mood swings, anxiety, and difficulty bonding with the baby. Depression exists on a spectrum from mild to severe. Mild depression involves sadness, low energy, and difficulty concentrating but doesn't significantly interfere with daily life. Moderate depression has more pronounced symptoms, impacting daily functioning. Individuals may withdraw from social activities and experience changes in appetite and sleep. Severe depression significantly impairs an individual's ability to function. Symptoms include overwhelming sadness, hopelessness, and suicidal thoughts. Hospitalization may be necessary in severe cases for intensive treatment. Recognizing the signs of depression is the first step towards seeking help. There are tools that are commonly used scales to assess depression. Beck Depression Inventory, BDI, is a widely used self-report questionnaire with 21 items, assessing the severity of depression based on symptoms. Center for Epidemiologic Studies Depression Scale, CSD, is a 20-item self-report scale measuring depressive symptoms experienced in the past week, commonly used in both clinical practice and research. Patient Health Questionnaire 9, PHQ-9, is a self-report tool based on the DSM-5 criteria for depression, used to screen for and measure the severity of depression in various clinical settings. Hamilton Depression Rating Scale, HAM-D, is a clinician-administered scale consisting of 21 items, used to assess the severity of depression symptoms. Montgomery-Åsberg Depression Rating Scale, MATTERS, is clinician-rated scale with 10 items, typically used to measure the severity of depressive episodes. Geriatric Depression Scale, GDS, is a self-report scale specifically designed for older adults, with 30 yes/no questions to screen for depression in the elderly. Depression is a complex interplay of factors with biological predispositions playing a significant role. The brain is a vast network of neurons communicating through neurotransmitters like serotonin, dopamine, and norepinephrine. In depression, these pathways can become disrupted, leading to imbalances. Low serotonin levels are linked to sadness and irritability. Depleted dopamine levels contribute to anhedonia. Genetic factors also play a role, with depression running in families. Environmental factors like childhood trauma can increase the likelihood of developing depression. Hormonal imbalances, particularly in women, can impact mood. Fluctuations in estrogen and progesterone levels during the menstrual cycle, pregnancy, and menopause can significantly affect mental health. Biological factors lay the groundwork for vulnerability to depression, while psychosocial influences act as triggers. Stressful life events like the death of a loved one, divorce, job loss, or financial difficulties can trigger depression. Chronic stress can take a toll on mental health, disrupting neurotransmitter balance and increasing the risk of depression. Early childhood experiences involving trauma, abuse, or neglect can leave lasting scars, increasing vulnerability. Relationship problems and social isolation can contribute to depression. Humans are wired for connection and belonging. Unmet needs can lead to loneliness and despair. Personality traits like low self-esteem and perfectionism can increase susceptibility. Negative thought patterns and beliefs can create a self-fulfilling prophecy. Addressing these thought patterns and developing healthier coping mechanisms are essential components of therapy. Psychotherapy, or talk therapy, is a cornerstone in treating depression. It provides a safe, supportive space for self-exploration, guided by a trained mental health professional. The therapeutic setting fosters trust and openness, allowing individuals to delve into the roots of their depression. Psychotherapists help individuals understand the thoughts, feelings, and behaviors contributing to their depression. Various forms of psychotherapy, like psychodynamic therapy and interpersonal therapy, have proven effective. Solution-focused therapy emphasizes finding practical solutions to current problems. Psychotherapy empowers individuals with skills and strategies to manage their depression. Cognitive and behavioral therapies, or CBT, are highly effective in treating depression. CBT focuses on the interconnectedness of thoughts, feelings, and behaviors. Changing one element influences the others, creating a ripple effect. CBT is based on the premise that our thoughts primarily dictate our emotional responses. Cognitive therapists help individuals identify and challenge negative thought patterns. Behavioral therapy focuses on changing behaviors that contribute to depression. Techniques like behavioral activation and relaxation exercises are used. Exposure therapy helps individuals confront feared situations or thoughts. Psychopharmacology targets the biological underpinnings of depression. Selective serotonin reuptake inhibitors, SSRIs, block serotonin reuptake at the presynaptic neuron, increasing serotonin levels in the synaptic cleft. SSRIs increase the availability of serotonin, regulating mood, sleep, and appetite. Side effects include nausea, headache, insomnia, sexual dysfunction, weight changes. Risk of serotonin syndrome if combined with other serotonergic drugs, for example MAOIs, triptans. SSRIs typically take 4 to 6 weeks for full therapeutic effect, and tapering is required when discontinuing to prevent withdrawal symptoms. SNRIs inhibit reuptake of serotonin and norepinephrine. Side effects include increased blood pressure, especially venlafaxine, sweating, agitation, nausea, and similar to SSRIs, but with higher noradrenergic effects. SNRIs are first-line or second-line agents for MDD, especially if fatigue, pain symptoms, or poor response to SSRIs. Other classes of antidepressants are available for those who don't respond to SSRIs or SNRIs. Bupropion, Wellbutrin inhibits dopamine and norepinephrine reuptake. They are FDA approved for MDD, seasonal affective disorder, SAD, and smoking cessation, Zyban. Pros: no sexual dysfunction, fewer weight gain issues. Cons: lower seizure threshold, so they should be avoided in epilepsy and eating disorders. Mirtazapine, Remeron, blocks alpha-2 receptors, enhancing serotonin and norepinephrine release. Pros: causes sedation and appetite stimulation, so they are useful for insomnia and for those who are losing weight. Cons: weight gain, drowsiness. Tricyclic antidepressants, TCAs, inhibit reuptake of serotonin and norepinephrine. They block muscarinic, anticholinergic, histamine and alpha-adrenergic receptors. Side effects include sedation, weight gain, dry mouth, constipation, and cardiotoxicity. There's a risk of QT prolongation and fatal overdose due to arrhythmias. Monoamine oxidase inhibitors, MAOI, inhibit monoamine oxidase, preventing breakdown of serotonin, norepinephrine, and dopamine. Side effects may include hypertensive crisis from the tyramine interaction in aged cheeses, wine, fermented foods, orthostatic hypotension, dizziness, sexual dysfunction. MAOIs are third-line treatment for treatment-resistant depression. They require dietary restrictions, a tyramine-free diet. One must wait 2 weeks after stopping MAOIs before starting SSRIs, SNRIs due to the risk of serotonin syndrome. Esketamine, Spravato, is an NMDA receptor antagonist. NMDA receptor blockade causes rapid increase in synaptic plasticity. Pros: fast-acting, within hours. Cons: given intranasally, monitored administration required. Brexanolone Zulresso is a GABA-A modulator which enhances GABAergic transmission. It is FDA approved for postpartum depression. Cons: IV infusion and expensive. Treatment requires a brief stay in a facility. Antidepressants can be highly effective, but are not a quick fix. It takes several weeks for antidepressants to reach their full effect. Side effects often subside as the body adjusts, but alternative options should be discussed if they persist. Beyond traditional treatments, alternative therapies offer holistic approaches to managing depression. These include ECT, TMS, VNS, and light therapy. ECT is effective for severe depression. TMS uses magnetic pulses to stimulate the brain. VNS involves electrical impulses to the vagus nerve. Light therapy helps regulate circadian rhythms and is effective for seasonal affective disorder. Electroconvulsive therapy, or ECT, is a highly effective treatment for severe depression, but it's often misunderstood and surrounded by stigma. ECT is administered in a hospital or outpatient setting with a team of healthcare professionals. Patients undergo a thorough medical evaluation, including physical exams and blood tests. During ECT, patients receive anesthesia and muscle relaxants to prevent discomfort. Electrodes deliver a controlled electrical current to the brain, inducing a brief seizure. Patients are closely monitored throughout the procedure and recovery. Suicide watch involves continuous observation to ensure safety and prevent self-harm. Depression and manageable. Treatment should be personalized based on symptoms, comorbidities, and patient preference. Subscribe to this channel for more mental health information.